but Congress is not particularly well equipped, apparently, to actually improve a broken system, which is what we have. At least they have not evidenced themselves to the media or to the American people as having a great capacity to improve the way a broken system functions and fixing the system. They can simply argue about how to pay to perpetuate that broken system, which I think a lot of folks are finding frustrating, and I think it makes a lot of folks want to change the channel, quite honestly. Right now, I want to bring in White House Deputy Press Secretary, who may actually disagree with some of the things that I said, but it'll be an interesting conversation either way, Bill Burton. And Bill, it's nice to see you. I'm going to ask you the same. Hi there. I'm going to ask you the same questions I was asking Chuck. There's a frustration on how do we pay. We've jumped to how we're going to pay for it and all this, but we haven't spent a lot of time on how do we get more bang for our buck. How do we do it as opposed to how do we pay for it, knowing that what we're doing right now is spending a lot and getting a little.
Well, those two questions are actually related in the sense that one of the important proposals that are up on Capitol Hill to help bend the cost curve for American families and businesses in the federal government is MedPAC. The idea that you have doctors and professionals who are making decisions on things that will increase the quality of care, find inefficiencies, and root out some of the waste in the system.
Right.
And so if you can give some power to MedPAC, you can root out a lot of the costs that the American people are having to pay right now.
And I understand that, but I think we would all benefit from a broader understanding of how health insurance works. In other words, people understand that their car insurance works in the sense that everybody is forced by law. The government has a law that says if you own a car, you have to have insurance because that's the only way I can make auto insurance reasonably affordable, although there's some states where that's not even the case. With health insurance, the government has never done that. People have not even had enough of that conversation. And I know we've begun it, but whether it's using health insurance or having conversation about more patient-driven structures, whether it's federal health savings accounts, whether it is a Wyden concept, or whether it's an Obama public option concept, that people don't understand why these are good ideas. They're being told these are good ideas, but they don't have enough of an understanding of the health system to understand the why, and I think that is a huge barrier right now.
Well, part of the reason that the president had a press conference last night and has been talking to different members of the media, including Meredith Vieira and all sorts of other reporters, is that he wants to have a conversation about these issues with the American people. And when it comes to getting people covered and bringing down costs, you're right, they are complicated issues. And even though there is broad agreement that we need to get health reform done right now, there are some disagreements on how we pay for it and how we bring down costs, and that's what the conversations on Capitol Hill are. Even as we speak, the Blue Dogs were over this week. We had some very productive conversations with them about how we bring down costs, how we make this deficit neutral.
Right.
There's some Republicans even who are working constructively towards a proposal. Now, there's also some Republicans who are trying to defeat this for politics.
Yeah, I'm ignoring the Republicans that just want to defeat it. I ignore because it's stupid. In other words, if somebody has an idea to try to improve it, we'd love to talk about it, but just to say we shouldn't do anything, to use the president's word, is stupid.
It doesn't make a lot of sense.
It just doesn't. I don't know why would you do that. But it doesn't mean you should go write a check and just give it away either, right? Like we need to sort of bury ourselves in this conversation one way or the other. What do you think what can you do from here to make it more accessible? A YouTube clip, something that can be put out by the president and digested, a cartoon, I don't care what it is. There's so many mechanisms to communicate why and how systems function, how capitalism works, why healthcare works in a certain way or in another way. Are you entertaining those types of techniques?
Well, we aren't entertaining cartoons necessarily, but the president is using all the different tools at his disposal. He has had the press conference last night. He's doing interviews with reporters. He's out going to Cleveland today. He's going to visit a clinic. He's going to talk directly with folks at a town hall in Ohio. So the president is going out around the country. The cabinet secretaries, members of the staff are going up to Capitol Hill and are also speaking directly with the American people online, on TV, on the radio, you name it. We're doing it.
What do you think about the Wyden plan?
Well, I think that there's some constructive ideas that Wyden has proposed. We're looking at everything.
What do you like what do you like about the Wyden plan?
I don't want to get too much into the specifics of what Wyden versus different folks are.
Understood, but you said there are some. Understood, but you said there are some good ideas there. The least you could do is tell me what some of those ideas that are represented are.
Right. I understand that. you'd love for me to negotiate out
no, I don't want you to negotiate. That's not fair to you. That's not what I'm trying to do, Bill.
I don't think it's the role of the White House.
That's not what I'm trying to do. You said you think there's some good idea, Bill. You said you think there's some good ideas in the Wyden plan. I think there's some good ideas in the Wyden plan in that it's a more patient-driven structure. I get rid of the corporate model and I push it down on individuals and give them more choice. I create a competitive environment for the insurers who have been basically charging economic rent to America for years now. We can obliterate that. I think the president made it very clear the health insurance companies are one of the big money leeches on this system. Whether you use the Wyden plan or some other plan, is it clear that the president, whether it's public option or some version of what Senator Wyden or others are discussing, that health insurance companies will be forced to a far more competitive environment? That maybe that'll be an easier way to go about this.
Well, competition is clearly important to the president, making sure that people do have a choice, because that's the only way you can really ensure that costs go down for the American people and for businesses that are just being crushed under these skyrocketing healthcare costs. And then just making sure that whatever proposal it is, it's deficit neutral, so that we're not just adding to the deficit and creating bigger problems for the American fiscal situation down the road.
And one thing I think everybody understands is, again, having one institution, basically the health insurance companies charging the rent effectively to facilitate all of this processing, is something we can't afford. We can't afford to pay the health insurance companies the rent we're paying them to facilitate our health care system, particularly when so many people aren't getting health care. The question is, and again, we're not going to solve it here. We both, I know you got to go, but if you want a quick comment there, I'm not going to deprive you of it.
I'm just going to say I obviously agree that unless we do something that's going to bend that cost curve, we're not going to be able to put the American economy on solid footing or put American families and businesses on the footing that they need to be going into the future.
And safe to say the health insurance companies are in the crosshairs. If I just look at the stock prices of the health insurance companies, honestly, they've gone from 60 to 20. The market already knows that the money being made in health insurance is over. Fair?
Well, I'm no expert on whether or not they're going to be able to continue to make money, but I do know that they're going to, if people like their coverage, they're going to be able to keep it. This is just about getting more choices so that we can bring down costs for the American people.
I love it.